And in part two of this consultation call, Danielle talks with this is a front desk manager or office manager of this practice, how to prevent no-shows, the steps to take after the new patient call, more insurance barriers, what to do about them, new patient scheduling tips, price competition, and how to utilize the implant warranty.
I think that if you keep that going, if you're already doing that and you get that patient in sooner, you're going to find that your acceptance rate is a whole lot higher. So
Right.
that's one thing I want you to get in. Also, if you're already doing that, great. Have them come in sooner. But also, if you're not sending them a new patient packet because you're doing things digital or however you do it, you got to send them something after that phone call, even if it's a letter.
Pack it out, and that is one of the things that Tiffany does.
Okay.
She kind of just takes on because there are days like Mondays. There are no patients here. He works somewhere else on Mondays, not for his practice, and so she's here on Mondays, and then she will go through and also with the new patient information, sending out letters. Well, he'll sign the letters, and then she'll send that information out and do all that. So she does. We do all that information out to every patient.
Good. Can you tell me what it is that you send?
We send them. We have a packet that tells us one sheet that just tells us who we are, what we do, what they can expect, all the different things that we do here. Just directions. Well, often I'll send the patient registration information in there just in case they don't do it online. Hang on, let me just see. What else I have here? Yeah, I mean, it's terminology is what separates us, and then it tells us about our technology, about Dr. Sierakowski, and then what we offer here, and then the directions, and then there's our office policy, and then that kind of information.
I would like for you to send me that packet just so I can take a look at it and offer some suggestions to you.
Sure.
So that is going out the day that you talk to them, right? Or the next day that you talk to them. Okay. So they're going to receive that within 3 days of talking to you. Good. Another suggestion on that is if you're talking to these patients, which you are, and you're forming these relationships, which you are, you know some personal aspects about this appointment and the reasons why they're coming in.
Right.
So for you, I would recommend that you put something personal in there from you to them. Hey, Bob, it was great talking to you the other day. I look forward to helping you with this, get this implant or get this, stability or whatever it is. When you come in, I'll be the one that greets you. My name is Joyce. We'll see you next week or whatever it is. Because those little handwritten things are great. It just brings that relationship a little bit closer.
He also does write when we put up our letters. He'll also write on the letter. That's one of the other things that he'll write on there that he looks forward to meeting them, and so that's also there too.
Yeah.
Yep. Okay.
Maybe just a little bit of something from you because you're the one that formed that relationship. They don't know him yet.
Okay.
Also, be sure because I always find that the patients are building their relationship with you on the phone or the assistant in the room. And it's very easy for these patients to get close to us because, for one, we're women and we just love to help and we have that nurturing, personalities anyways, that it's really important for us to really talk up our doctor. I will have patients a lot that says, gosh, I went to this doctor, I had a bad experience, or, they'll just say, I don't really know who to go to, or, they're expressing some concerns and worries and, that sort of thing. And I always say, listen, I have been with this doctor. I've been with my doctor for 15 years, and he has been in this building, in this facility for 35 years. He is great. I will tell you, hands down, he is just great. He is very honest. He'll tell you exactly, what he thinks you should do or shouldn't do. Patients just love him. They come from all over to see him. He's very caring. He's very compassionate. I will tell you honestly that do not worry about this doctor.
Right.
People just love him, and be sure that because they now have trusted you. This is, of course, after they're like, oh, you're just so great. Thank you so much. be sure that you share that with them, even if you don't think it's a concern, just to say, hey, I'm going to tell you something. You're going to love him. You're going to love the staff. You're going to love him. It's just different from any dental experience you're ever going to, find, because 95% of people calling you are freaked out about meeting your doctor. They just think that they're just, mean, just, money absorbed people, and, they're going to take all their money and they're not going to treat them well and so on. And you're working for them. So, if it's not kind of said in that, hey, just between you and I kind of thing, they're just not going to really, that's not going to be cleared from their fears unless you kind of say it. So I always recommend that you end with that as well.
Do that. There is so much dental fear out there to begin with.
Yes. Absolutely. So definitely recommend that. So
dentist and blah blah. I hear it all.
Yeah.
You have to constantly
see if you can add that to your new patient packet, and that way you have a little bit of something there. Scheduling some help, having them come in sooner, and then the other thing is, once you have them come in and you're doing the new patient examination, or they're having the patient examination, and who does that? Is it Tiffany that does the examination?
Yes.
With the doctor?
Yes.
And then who presents the treatment plan?
I do.
Okay. So who comes to you and gives you the plan, Tiffany?
No, the doctor.
Okay.
Frequently what he'll do is, when, not all the time, but for the most part, that he'll put the treatment in when he's with the patient in the computer. He'll just put it in there. But or he'll bring the patient up. He brings the patient up, and may just tell me when I'm here, just jotting things down. This is what we're going to do, and then this is what we need to do next. Or,
Okay.
So that's how he always brings the patient up.
Okay. All right. And so then you work the plan up? And
work. A lot of times what will happen is, because their insurance is insurance 90% of the time. If it's not, I'll just present it to them right there. And it only takes me, won't take me long most of the time.
Okay.
And it's just a couple of minutes, and I'll print it right up. If it's insurance, then I'm waiting, because I'm sending it to the insurance company. And even though, I don't have all the exact details of what their plan is going to pay for this treatment plan. So what I'll do is tell them I'll let them know I'm setting the treatment plan in for the insurance company. Often I will just hand it to them. I'll hand them the treatment plan and say, this, it won't necessarily be an accurate, this is what we're doing, but it might not be the exactly, it won't be exact for what you would have to pay, because I need to send it to the insurance company. And it gives them an idea of what's being done. So that's another part of the, the issue. I know that, it's better if you can just let them know right up front, this is what's happening, this is what you need to do, but that can't always be the way it is.
Right. So what's the percentage of the patients that you're handing them the paper and calling them back later because you're waiting on insurance?
A lot.
Okay,
a lot.
It's more than 50%?
Because they are in-network, they're just, because it's insurance-driven, they want to know exactly what the insurance is company. I want to know what the insurance is going to do, or they'll schedule, they'll frequently schedule. I'll say, it would probably be best if we schedule an appointment. In the meantime, I'll send this insurance information out. I'll get it out, I'll be electronically sending out the information to the insurance, and as soon as I get it, I'll email it to you with a note, and I'll call them, follow up, and say, go over the information with them, but they still have an appointment scheduled, especially because of the fact that we're scheduling, 3 or 4 weeks out. It makes sense anyway, to at least get something scheduled on the book.
Right. Yeah, I definitely would say to them, I'm going to put you on the books. We can always move it if it doesn't work for you, but we are scheduled 3 to 4 weeks out.
Exactly.
So going to schedule you, and then once I give you a call and we explain all the benefits and such, we can change that, move that, but I definitely would keep that because that's going to keep you from losing the patient. Now, for insurance, I'm going to suggest a few things. And again, just kind of be open to the new ideas because you have been doing this for a long time. So it's really hard for people who have been doing insurance for so long to kind of see outside the box because for you, it's very structured and it's very, clear what you have to do because it's insurance. It's just very difficult to explain to patients anything other than using their insurance. I understand that. But I feel that for the patients that are coming in to see your doctor, a lot of times it's not cosmetic. It's a need. Is that correct?
Yes.
Okay, so it's a need because it's perio. It's a need because it's protecting the teeth, the gums, the recession, the replacing a missing tooth because they don't want things to shift or other teeth to get damaged. Most of what you guys are doing is a preventative. It's let's not damage the other teeth. I want to make sure that I know your doctor is amazing at what he does because I've read and heard a lot of things about your doctor, but to make your job easier and acceptance better, it's really good for him at the end and, or when he's planning for patients to understand that it's very important that they do this and do this soon because we want to prevent this. Maybe he's doing that, and that's fine. But we want to be sure that we get this tooth replaced as soon as possible because if not, these 2 teeth here are going to shift. This tooth up here is going to be moving down. These 2 teeth here are already endo-treated, and we don't want them to take on any other stresses. We don't want things to get worse. I don't want this recession to get worse because of this. So the best thing you can do to avoid a more expensive plan down the road or to, avoid, more damage being done is I'm going to have Joyce try to get this on the schedule as soon as possible. That's something I always have Dr. Shillem say. Even though he says it's every patient, I'm going to have Lisa get you on the schedule as soon as possible because I don't want this to get worse. And I see this all the time. Of course, don't make it up. If it's not going to get worse, it's not going to get worse. But for most of the time, it is. It's disease. Right. It's whatever it is. So that they have that sense of urgency already being planted. The second thing is I always say with patients, because most of our patients do have insurance, dental insurance is different than medical insurance. Medical insurance, there's really not much of a cap. There's not a cap on it. If you need heart surgery, they're going to cover all this stuff no matter what you need to have done. For dental insurance, we're talking about a little bit of money here. We're talking $2,000 max per year that they're going to cover. And I always say to them, you're going to get this done no matter what your insurance tells you because you need to get it done. You know that. I know that. You got to get this done. But of course, it's going to be great if we can get your insurance company to pay this. If your insurance company is not going to pay this, then there's other things you can use your insurance for. You can use it for the abutment and crown with your dentist. You can use it for other things down the road if you need it. But, we're not going to allow your insurance company to dictate if you can or can't do this. We know that you're going to be doing this. So I'm going to call the insurance company. I'm going to see what they can cover. But just please understand if they're not going to cover much of it or any of it, it is something that you still need to have done so that they do understand. For one, the insurance company is not going to cover the whole thing. They're not going to cover a whole lot of this. And I think a lot of patients, when they come in, they have the mindset of medical insurance. I pay for this dental insurance. I want to use this dental insurance. They're going to cover what I need to have done. When it's not like that a lot of times.
It's really incredible how many conversations I have with us too, and that it just gets lengthy. And
yes.
I just keep trying to explain to them this is. Dental insurance is just an adjunct. It's really, it's again, like you said, it's not the same. It's just something that's there to kind of help you along the way, give you a little added support, but it's not it's not there, to cover everything. I definitely have these again do have these conversations with
Right.
people.
Good.
Good. You know you're going to need a crown, so you're only going to get so much. So you are going to need this insurance. You don't have that much insurance that you're going to be able to use it all for everything.
And they do know that they can use it at their general dentist. They can use it for the restorative stuff.
Exactly.
Okay. Which usually for me, more times than none, that's what saves me, is they have forgotten that it's not just the work they're having at our office. They're having work done at Dr. Smith's office as well for the crown and the abutment, and
right.
And usually that's much easier covered than the surgical portion, anyways. So
right.
just for us, we have a lot of people that have, because we have a lot of engineering companies near us. For one, they're engineers, so they're different. They have a different mindset,
right.
anyways. And then you have that they're very insurance driven, and they all have the same insurance. So for us, that I always tell them, most of the insurance companies don't cover implants. They just don't. So so for us, that's the problem that we have, is they don't cover insurance. So now they're going to look at doing a bridge. Well, my insurance company covers a bridge, so I'm just going to do a bridge. So I have to spend a whole lot of time for these younger engineers for them to understand, it's not that a bridge is a bad option, but I want you to look at it as an investment purposes.
Exactly.
Okay, the bridge is going to last you 7 years, maybe longer, but really the lifespan on the bridge is 7 years. And let's look at this model here, or this video here. Let me show you what they're doing. They're taking these two really good teeth here, and they're going to shave them down the pegs, and they're going to give you a bridge. Looks good, feels good, but look at an implant here. An implant is made to go in and stay in forever. It's a prosthetic root. It leaves the other teeth alone. Your investment on this, hands down, is much more, because you're not going to have to get the bridge taken off, redone, caries under the bridge, so on and so on. You're done. You're set. So it's better investment for your money. So you may not be able to use your insurance for it, but it's going to last you forever. You're not going to have to redo it again. So it's kind of educated not only on insurance, but the value of investment and what they're going to have to be doing later on down the road, and plus what's healthier for them, what's better for them. So, and then again, if it's not going to cover the implant, use it somewhere else and have them cover the crown. So, yeah, it is spending some time, and sometimes being creative with, I know that you're already spending some time talking about them, but what are some other things that maybe we can educate them on? Are you using models? Are you using videos? Are you having your doctor help you with this stuff? For example, if, how do they understand the difference between the bridge and the implant? They understand, if they don't do the perio treatment, if they don't do the gum surgery, to be sure that he is programmed to see that when he's planning, so he can lay the groundwork for you when you go to present to help you with that. And we've spent a lot of time with Dr. Sheldon to make sure that happens, because I tell him, once we get into the financial room, once they come to the front desk and you leave, it's going to be hard to get you back up there again. And so I need you to really help me with these things in the room, because I need them to be thinking this when they come to the front desk. Right. So our Tiffany's, our people that's in there, if they're talking to the patient and the patient beforehand tells them, well, if this implant's too much, I'm just going to get a bridge. If this implant's too much, I'm just going to get a partial denture. I don't want to spend a whole lot of money on this. Right. I know the guy down the street will do this for X amount of dollars. I will give that information to my doctor, because I want him to be sure that when he goes in there, that they understand a general dentist may do it cheaper, that a bridge may be cheaper, a partial may be cheaper. So I want him to educate the patient on what's going to happen if they go with that choice. Right. I know in our area that the only people that's going to be cheaper than us is if, for example, they go to the corporate place down the street and do their root planing. But is that a better place for them to go? So I say, listen, I know that if you go down the street, it's going to be cheaper to do your root planing, but they're not going to have the endoscopic periodontal dental view that we have, the endoscope that we have. And here's what the endoscope does for you. Or our hygienists are highly trained with periodontal disease. So the root planing that you're going to have here is different than the root planing you're going to have there. So I really want you to understand that we don't have repeat root planing here. We don't. If you come here and have it done here and you do your cleaning regimens afterwards the way that the doctor recommends that you have done, you're not going to have it done again. We're going to take care of you. We're going to make sure it doesn't come back again. So to spend that time on, like what you said before, what separates us, you and I sometimes have to be reminded of what we have to reiterate and remind them and educate them on, because we forget about the guy down the street. We forget that our doctor is so much more educated and so much more trained, because it's normal for you. It's what, so we do have that we have to remind ourselves about daily, to remind that patient of what they're going to get when they go down the street.
Right.
Do you have?
I agree. And he's very good. And that is the one thing that I hear from the patients a lot as well, is that he does spend a really good deal of time with them. And he does present all the options. I think this is the tooth, this is what's going to miss, and this is what you have the option. Yes, you have the option for, just to take the tooth out and not do any. This is if you do nothing. This is bridge. This is an implant, and explaining why, like you said. And he's very good at that, and he has a really good way about doing it. And that is what I hear, even as they're coming up. I really appreciate the fact that he spent that time with me, because there's too many dentists that they go to that don't. They just don't. They just said, okay, this is what, and they don't get that. And that's what I feel for us makes the difference, is because he does spend the time and he listens to them, and he will explain everything to them. He really is very patient and listens to them. And it's just, and it's good, because they hear it, and then they acknowledge it to me, and when they're coming up, wow, I really, like your office. I really like the way that he talked with me, and he really made me understand it. Not necessarily that they're always still going to follow through with it, but it makes a big difference to me. And they'll refer people, which is another good part of it too.
Right. Good. No, that's excellent. Do you guys have a lifetime warranty that you advertise, or any warranty that you guys advertise?
I don't know that it's a lifetime warranty. He does say that if he's talking about the implant, if something happens, he'll do the percentage of 90%. That you successful. If for some reason it doesn't, if the implant fails, we will come back and do it again, at no cost. So he does say that. I don't know that he says a lifetime guarantee, but he does say that he'll redo the implant if there needs to be a revision on some grafting. If he feels that he's not comfortable with it and there needs to be a revision, he'll do it.
Okay.
Be right. But he's very clear about what the expectation needs to be in a lot of these situations too. So.
Okay, so I will tell you, because we have a lot of competition. Well, they're not really competition, but we have a lot of dentists in our areas, and all the dentists in our area do perio work, implant work. They do everything. So we have a common problem with when patients are coming to our office, they want to get a second opinion, or they've had a second opinion, and we're not the cheapest. We're actually probably the most expensive. But on our form that's called the What Separates Us form that we use when we send out the new patient packet, that we use as verbiage when patients are calling our office, and that we give them with their financial estimates when they leave the office, or their paperwork when they've accepted or not accepted or whatever. The one wording on there that what separates us from others is I put on there a lifetime warranty, and it just tells them that we have a warranty. And when I verbally explain that to patients, I tell them kind of what you just said, but I make sure with every patient, even if they haven't expressed it, because I always treat patients that are leaving, even if they scheduled, that they're probably going to call around or talk to other people that may have seen somebody else and may be interested in seeing if they can get it done cheaper, just because that's just what people do. So I tell them, I do want you to know that I talk about my doctor. He is a specialist. He went to school 2 years longer than the other ones. He is specialized to do this. He is going to take really good care of you, and patients love him, and we have great results. The other thing I want you to know is that we warranty all of our products and services here. So if you have anything done here, we are going to make sure that it is done right and done the way it's supposed to be, or we will, do it again until we do get it right. Our doctor is a perfectionist, and he makes sure that the treatment that we do here is treatment that's going to last you, and it's going to work. We see a lot of, because we are specialists here, we do see a lot of patients that come in with failed work and have to have it redone again, and they have had this work done as soon as 6 months ago. So they have to reinvest in this. So we do guarantee all of our work. For implants, our implants that we do here in our office, we do guarantee for life. So this implant will last you for the rest of your life, or we will redo it. Now, I can send you, if you don't have it, we do have a implant warranty consent form. It does not include the abutment. It does not include the crown. It only does cover the cost of the implant. It also is voided if the patients do not come for their yearly check or quarterly check, whatever the doctor recommends, with that particular patient. If they don't come to those visits, the warranty is void. So you're only warranting compliant patients. Also, it does not cover patients that are smokers, or patients that have like out-of-control diabetics, and patients that have medical things that would prevent them from, of course, being able to take, to heal. So those are on the implant warranty, but that warranty does attract a lot of patients, and it does make a lot of patients say the guy down the street is a bit more expensive, but that warranty is pretty good. I do want that warranty.
Right. I got you. Yeah, that makes sense. That makes sense.
Good. So is that stuff helpful to you?
Yeah, no, that's very helpful to me. If nothing else, it definitely, just gives me a little bit more,
Yeah. Yeah, like I said, what I find with a lot of offices, Joyce, is that there's people like you and I in these offices everywhere, and you guys are dedicated, you guys are great, you guys are knowledgeable, you guys are good, but sometimes hearing something that someone else is doing, you don't know until you know. So when you hear some of these ideas, you can put your own twist on it, and you can sometimes achieve a lot just with a little bit of advice and information.
Exactly. I know. I agree. That's why I thought, well,
Yeah.
I wanted to, get other insight with it. So, yeah, you do. You just keep going on your own way. You need to see things differently, and sometimes.
Well, if you will send me to our office address, if you will send me your new patient packet, and if you will send me your what separates you form, I would love
which one?
The what separates us.
Yep, I'll send you the package, everything we put in that package.
Perfect. I'd love to take a look at that, and I can let you know things. I can email you on some things that I would change or do differently in that way. Good, perfect.
Sounds good.
All right, well, thanks for the call, or thanks for talking with me about some of your stuff. If you have any other questions or if you need anything else, always give me a call back.
All right, thanks, Daniel. I appreciate it. You have a great day now.
You too. All right, bye-bye.
All right, bye-bye.